Hello, I am Dr. Manish Kumar Mari. I am a senior consultant nephrologist and transplant physician at Pune. Let's discuss about edema today. Edema, in simple words, is a swelling. This swelling can be seen on the part of the body or entire body. One can notice this swelling around the eyes, around the face, around the legs, around the arms, around a particular ankle, or the entire body. Now, this swelling could be physiological or it could be pathological. So, what is physiological means? Physiological means it's a part of normal physiology of the body, and this swelling can come and subside on its own. It's for the transient period only, and this kind of swelling will not progress further, and one need not worry about this type of edema or the swelling. What is pathological? Pathological is there is some pathology or abnormality in body or in particular system of the body, let's say kidney, liver, heart, lungs, etc. And this pathology, if not diagnosed and not treated or not addressed, will progress further. Now let's see about the physiological types of edema. Before that, let's see where we can see edema. Edema can be seen around the eyes in the morning, which may get subsided as the day progresses, which may reappear next day in the morning. Edema can be seen around the legs or around the ankle or around the entire length of the leg. This edema will be more pronounced if the patient is standing or sitting for a long period of time, and if he is lying down or after getting up from the bed in the morning, there will be no edema. So this type of edema could be physiological edema, and it is because of the high pressure seen in the small vessels or the capillaries of the leg, which will seep out some amount of fluid from the blood. And again, when in lying down position or in the horizontal or flat position, when there is no pressure on the legs, this fluid will again go back into the blood circulation and the edema will disappear. So this is a physiological edema, and one need not worry about this edema. If someone gets some injury, let's say ankle sprain or some fracture of the leg, then as a protective mechanism around that part there will be a lot of inflammation occurring, and this inflammation will lead to the inflammatory substances to be secreted by the body, and there will be a lot of pain around that area, and there will be edema. This edema will take time to subside, but remember here the edema is not a problem. Edema is a protective mechanism by body to sort of immobilize that part and prevent further injury. Now third thing, edema could be because of the insect bite. It could be because of any bee bite, or it could be because of mosquito bite, or it could be because of any other insect bite. Now this edema will be around the bite, and here we have to treat the complications related to that bite, because this edema will likely to subside. Then fourth is edema can be seen normally in pregnant women. This edema is more pronounced if this woman they are having anemia or low hemoglobin. In this condition also edema will be seen compared to normal persons. Now let's talk about the pathological edema. Pathological edema would be because if there is some pathology in some system of the body. It could be related to kidney, it could be related to liver, it could be related to heart, it could be related to brain or lungs or any other organ. Now let's talk about edema of the kidney. Now in certain conditions of the kidney where we say it's a nephrotic syndrome. So here in this condition of the kidney leak protein in the urine. So ultimately there is low protein in the body, and because of the low protein, body tries to retain the fluid, and this retention of the fluid will lead to the edema of the feet. Now classically this edema is initially seen around the eyes in the morning, and as the day progresses this edema shifts from eyes to the legs. So this kind of shifting edema is seen in kidney patients in the initial stages of the disease. Later on there could be edema all around. Now if we see this edema, the skin is stretched, skin is glossy, and if you press on the shin of this patient, a pit will remain there, and it will take time for that pit to come to normal. So this kind of edema we call as pitting edema. As against that, in certain patients like thyroid patients suffering from thyroid or a low thyroid, hypothyroid state, this patient they will have edema of the feet, but which will be non-pitting. So if you press hard with your thumb on the shin of this patient, the pit will not be formed, and this is a non-pitting edema. Now in certain conditions of liver like cirrhosis, there will be edema, but this edema will be more around the abdomen or the tummy of this patient, what we call as ascites, and as a part of low albumin there will be some edema of the legs or the face. Now third thing, edema because of the heart condition. Now this edema is usually not seen on the legs, but this edema, the fluid gets accumulated in the lungs of the patient, and this patient, they will feel very breathless because of the accumulation of the fluid in the lungs. And the fourth type of edema which we see mainly in the hospital setting is a cerebral edema, where there is edema or the swelling of the brain. Here the patient loses his consciousness, or there is decrease in the level of consciousness, and patient needs to be admitted in ICU. Now what is the treatment option for this edema? Now if there is edema, it means there is excess fluid in the body. So for these patients, we should ask them to restrict the fluid intake. That is the first and foremost thing. Then the second thing would be to restrict the salt intake of this patient, because if these patients, they consume a lot of salt, then this salt will retain the fluid in the body, and the edema will worsen. Now the third thing is giving them some diuretics or water pills. Now what do these pills they cause? They cause excretion or the secretion of water from the body. So excess amount of water can be secreted out in the urine, and patient will lose water from his body, and the edema will subside. Then the fourth thing is, if there is some local pathology like sprain of the ankle or some insect bite or something, then applying cold compressions, applying ice, or applying external compression like DVT stockings or etc., the edema will subside. And of course the treatment of the primary conditions. Now if it's a kidney problem, or is it a liver problem, is it a heart problem, please consult your doctor. Let doctor decide about the further evaluation and the treatment of this edema. Now there could be some edema because of side effect of certain medications also. Some blood pressure medications, there could be some amount of edema seen on the legs of the patient. So if we notice that the edema or the swelling has occurred after the onset or after the initiation of the medications, then please consult your doctor. Doctor might change your medications also. So remember, all edemas, they are not abnormal. Certain edemas, they are abnormal. But edema could be, or a swelling could be, the initial sign of some deadly disease in the future. So let's not neglect edema, let's not neglect the swelling. Let's consult doctor as soon as you notice symptom or the edema or swelling around your ankle or around your eyes or around your face. So please consult your doctor if you see some swelling in your body, because swelling is not a normal thing. Thank you.